My name is Dr. Mahmoud Idrisa Abeid. I am a medical doctor from Tanzania, currently working at Abdullah Hospital, a public hospital in Pemba, Zanzibar. I received scholarship from Merck Foundation to study postgraduate diploma in endocrinology, which is under the Merck Foundation Nationwide Diabetes and Hypertension Blue Points program. And I completed my course in 2022. The course content was relevant to what I expected from the training. It was relevant to what we practice right now in terms of evidence-based practice to deliver the best available care to the community we are serving. And also the platform of learning was interactive, allowing us for group discussions and personal reflection. All course coordinators in all 6 modules of the course were especially skilled in the field, and we had the best experience during training. Through this training, I was able to improve our practice in endocrine services. As we know, non-communicable diseases including cancer, diabetes, hypertension, and other cardiovascular diseases have shown an increase in prevalence for the past decades. That is due to various reasons, but including changes in lifestyle and, of course, advances in diagnostics. So we as healthcare practitioners have to adapt to that pace, which means we have to update and advance our knowledge so we can deliver the best evidence-based practice to the community we are serving. This training has allowed us to detect patients with endocrine illnesses early, and as we know, the earlier the detection, the better the prognosis. When you get to identify a patient earlier, you get to investigate them thoroughly, initiate treatment on time, and prevent complications. This training has also enabled us to reduce the number of patients requiring referrals to higher level facilities for consultation to endocrinologists, which are few, by the way. So right now we are able to manage them at our own facility at the district level, and therefore we are reducing the cost for them to seek healthcare at higher facilities. This training has also enabled us to see what we need in order to diagnose and manage endocrine illnesses. Meaning we know which diagnostic facilities we need and which medications and drugs we need to manage patients accordingly. But also this training has enabled us to collaborate with our colleagues in gynecology, particularly in matters relating to reproductive endocrinology. So we are able to manage and help them manage patients who are facing difficulties in fertility and conception through hormonal treatments. I will most likely refer this course to my friends and colleagues because, first of all, the content is relevant to what we practice. And secondly, you get to receive the content online, the same content that you will receive when you are doing face-to-face training in class. So you can do your clinical practice, academia, and clinical research at the same time while receiving training online. And also, considering the changes we are facing right now in terms of disease prevalence, I'll advise my colleagues to go for further studies, particularly in this course. Thank you, Merck Foundation, for this opportunity.